A local startup is close to commercializing a medical device that could reshape an entire industry. On the Courier's front page centerpiece this week, healthcare's next big thing. It's a disposable device slightly larger than an Oreo cookie, created by Enable Injections, led by CEO Mike Hooven. The device, called a bolus injector, will allow patients to self-inject biologic prescription drugs with the touch of a button. The bolus injector could be used to administer a large dose of a drug to combat anything from cancer to hemophilia. Enable's workforce now totals about 70 and is expected to grow, with all receiving equity in the company.
We are giving an equity stake to everyone, from production workers to staff members. And it really helps because everyone is together in terms of achieving the company objectives, and they can see the value of their equity increase, and they can see how what they're doing contributes to building the value of the business.
The Enable injector might eliminate the need for long intravenous treatments at a doctor's office. Hooven says the big difference with the Enable device is you don't have to be skilled to use it. Now, Business Courier reporter Barrett Brunsman spent some time with Mike Hooven, and he joins Business Courier editor Rob Dawmeyer in the studio with more. In full disclosure, I work for Cincy, an investor in Enable Injections. I did not contribute to this story. We'll toss it now to Barrett and Rob.
Thanks, Peg. You did not actually write the story, but you do like the company, and there's a lot of reasons to like this company. Thanks for being here, Barrett. Peg mentioned, you saw the picture, it's about the size of a cookie. She mentioned a little bit about how it works, but maybe you can go into a little bit more detail about why we wrote the headline, could this be the next big thing in healthcare?
Yeah, Rob, a patient could take a vial of a standard drug vial, insert it into the bolus injector, attach it to your stomach. The push of a button, a needle automatically comes out, sticks on you there, and then you're basically self-administering these drugs. The neat thing about it is people used to have to go to doctors' offices or hospitals to get intravenous injections of serious drugs to treat things like cancer. The idea behind this is now you could put this on, you could go shopping at Kroger or shopping at Macy's, continue to do your daily, everyday kind of things, and not have to take time out of your day. The second idea is you could greatly reduce the cost of healthcare because you're no longer having to pay someone to administer these drugs.
Right. That's just, even looking at it and reading it, it just sort of clicks right away. At least it did for me. That, oh boy, this thing really, it could be a game changer. But who out there, what companies are interested in Enable's device?
Big pharma companies. Some of the drugs they sell might cost $500 to $1,000 per dose. The Enable device might cost $25 to $50 to deliver these drugs, but Mike Hooven tells me that there'd be no pass-along cost for that to the consumer because the drugs themselves cost so much money. Enable has signed numerous agreements with many companies, but they still have to get USDA approval.
Right.
So we might see this actually roll out in Europe first before it's here in America.
Interesting. So Peg mentioned that it doesn't hurt much. Is that actually true? Does it hurt?
The whole concept behind this was to develop a painless device. The technology was developed at Cincinnati Children's Hospital so that babies who got vaccines wouldn't feel this pain. Enable took that and developed it for 2 years and then discovered there wasn't a big market for that. The big pharma company said, we're already selling vaccines. So they pivoted and decided this could be a big market for these major illnesses affecting adults. And so that painless technology, though, carries over to this device.
Yeah, it's a fascinating story. I'm sure we'll be writing a lot more about this. You specifically will be writing a lot more about this, I hope, and thanks for being here.
Thank you, Rob.